I've been a dental therapist since 1983. A lot has happened. When you're hearing everything everybody's talking about today, it just takes me back to when we were new grads and we gave lessons in schools and we did the oral health promotion and we did everything and we travelled around in vans. So it's lovely to see everything turn a full circle. Extending my scope and how it changed my working life. In the past, all of you know what therapists did. We did general treatment on children up to the age of 25. That's an extension of children, but it was sort of the age where most people had finished university and then they were off to school. After that, we said goodbye to them and transferred them on to someone else. We did x-rays, we did deciduous pulp therapy, we put stainless steel crowns on, we did preventative treatment, and we gave oral hygiene instruction. Once they turned 25, often they would say that it was sad to see us go and they would like to continue the relationship. Often parents would come in and say, I love the way you explain things to the kids, I wish I could see you too. That was what I was frustrated by, dismissing patients once they turned 25, feeling as though my skill set wasn't being utilised for appropriate patients. And by appropriate patients, I mean it's not their dental care that was appropriate, it was more their anxiety or their behaviour or just the comfort level. Anything outside my scope was best sent off to the dentist, of course, but there were people who didn't need that. They needed a lot of TLC and they needed to get confidence in themselves to go on to the next step. I was also feeling frustrated by the fact that I'd be working in community out at each as well, and there'd be walk-ins come in, someone with an abscess, someone needing general care. I had a patient that didn't turn up. And at that point, I couldn't help any of the dentists. I couldn't even triage it. I couldn't take an x-ray. I couldn't do anything to help them when they all had a full patient load and I was sitting there doing nothing. I believe that my skills in patient anxiety management could be used for a particular group of people. We see a lot of people who've been ex-drug users, a lot of people with mental health issues, and a lot of the skills with children with dental anxiety, not treating an adult like a child, but explaining everything, showing everything, not pushing everything, helps a lot of the adults with those same anxiety issues. I chose to do the extended scope of practice because I always thought that it was something as a therapist we could do, and I always felt that if given the opportunity we could do what we do for children and do that well for adults as well. It extended myself and it extends my working life as well. It helps me provide assistance to people that I work with in the teams that I work at. I work at the dental hospital and I work in community, and it makes me feel more part of the group and able to take on patients that the dentist may have done emergency treatment for, and then they leave a treatment plan for me to execute. Or I might see someone for something quite simple and refer them back to the dentist to do something more complex. As you can see, I've tried to do this for quite some time by taking part in every plan that was given. And when the first scholarships were offered by Dental Health Services, even though I was terrified because I hadn't done anything for 30 odd years, I felt the fear and I did it anyway, and I can highly recommend that to anybody else. What it involved was 6 months of my life, clinic 2 nights a week at the dental hospital after working all day, from 5 till 9 o'clock, lectures once a week, and several 5-day full-time blocks of lectures and clinical practice. There was essays involved, clinical presentations, oral medicine presentations, clinical exams, and clinical supervision by my senior dentist. And my senior dentist was Rupali, who's sitting right here. Rupali was wonderful. Rupali was supportive. Even now, if I've got an issue, I will go and talk to her. In the first 12 months after completing the extended scope, I would be talking to her constantly. It took, I found, about 12 months after graduating and working on your own to feel as comfortable with treating an adult as it did with treating children. So if you've just started, don't feel that you're supposed to be fabulous at it straight away. It does take a while until you're feeling as confident with adults as you are with children. What I do now. I work in 2 places and my work is different at both. At the dental hospital, I work more under prescription from the dentists in that Dr. Beaumont and Dr. Scully and Dr. Kong will often see a patient for screening, and if they feel that that patient only needs a couple of appointments and it's not worth putting them through the undergrad system where the students have to do a complete exam and the patient is desperate to get dentures or whatever, they'll send that patient to me with instructions on what to do. Then after I've finished the care, I refer it on to RMIT, who will then make their dentures. So it works in a really nice collaborative team approach. If there's any extractions that need to happen or something changes from the original screening, I'll refer it back to them. So I have structured professional relationships with all the dentists that I work under. I feel that relationships is the most important part of working as a therapist with extended scope. You can't say this person is capable of doing this and therefore send all of this to them. You need to have a relationship that you'll feel confident that the person that you're working with has the skills and has the patient management that you want in a patient that you're sending to them. So it does take a year or more to develop these relationships. At Eastern Access Community Health, I often follow the dentist's plan after they've seen the patient and they may have extracted teeth or done root canal treatment or even just seen them for an emergency. Or I can create a plan for myself and I'll do everything that I'm capable of doing and then refer it to the dentist to do their treatment plan for things that are out of my scope. I work in tandem, for example, with emergency patients. If we have a patient come in with a swelling or we have a patient come in pain, I can triage, I can take the x-ray, I can go in to the dentist who's working in another room and say, what do you think of this? And they'll give me instructions. They'll say, could you put in local? And I'll be in a moment. Could you inform the patient that I need to rebook them to do this, or I'm going to be in a moment to give you a prescription? As you can see from the clinician's scorecard, this was at each. Don't know an awful lot about DWAS, but the total there before I had the extended scope, and this was before the CDBS as well, was at that point, and it's doubled. So it's well worth investing in having a therapist that you feel that could help your team to complete this course. At the hospital, this was beforehand, and I haven't been doing this quite so long, and I'm only here 2 days. So the increase isn't as large, but it is as large. It is larger, and it is getting bigger. The benefits, my personal and professional satisfaction levels have gone through the roof. I actually feel like I really make a difference. I really enjoy feeling that I make a difference to a lot of our mental health patients. There's a lovely group of men that come in from an intellectual disability home not far in Ringwood, and they be in their late 50s, but they're probably all of the mental age of about 9. And after they've left, you actually feel that it's a joy to do your job. They are lovely individuals, and that's something that I would miss out on normally. I treat mental health patients. A lot of the patients are still on methadone programs, and they're very anxious, and their pain tolerance is very low. And often through the course of time of seeing them, they relax and they're more capable of doing more complex dental treatment. I arrange appropriate referrals, and I work with the elderly and the intellectually disabled has been an unexpected pleasure. There's some older people I work with who have just had the most fabulous lives. And this, motivational interviewing that we do these days is having a conversation with them. What are they expecting out of their appointments, all the rest. But you hear about some of the wonderful lives they've had. We've got people you wouldn't expect that used to be violinists with the national orchestras. You've heard people who were pilots. You've heard people who've had the most exciting lives, and you don't expect to be seeing them in a public practice. And to have the time to talk to them and treat them has been wonderful. Once again, I think that the relationship building is the thing I stress on the most. It's the relationship with the patients and the relationships with the dentists that you're working under, because having that trust issue of what you're capable of is the most important thing, and I would recommend it to all therapists who would like to take it on. Finally, I was talking to Julie outside just before, if you want to apply to do the extended scope as a dental therapist, they have held these 50% of the positions available are for people who are dental therapists and 50% for the Bachelor of Oral Health. So you won't be competing against people who may have had a different background to you in to where you are working now. So I think that the therapists that have been around for a very long time, you may not have been studying recently, but there's an awful lot of life experience that you're going to bring to the role that you can't get any other, and you'll really, really enjoy yourself, and I can't recommend it more highly. And I've gone very fast, and I'm glad, and we can move on to the next one. Thank you.